For a senior couple retiring today, they will spend an average of almost $500,000 in health and medical expenses, including health insurance premiums, dental, vision, copays, and out-of-pocket costs. And as these costs continue to rise, it's clear that the country is in the midst of a senior healthcare cost crisis. Fortunately, a new bill was recently introduced in Congress that will give seniors a way to pay for the cost of health care in retirement. Joining me today to talk about this new bill is Michael Friedman, the CEO of Lighthouse Life. And Michael, we're talking about H.R. 5958, the Senior Health Planning Account Act. What exactly does this new bill do?
Thank you, Melanie. What the legislation does is provide a way for seniors to invest in their own health care through the sale of their life insurance policy, which is known as a life settlement. In this country, as you pointed out, there is a senior health care crisis where seniors don't have enough resources to pay for the costs that you outlined, such as out-of-pocket costs, premium costs, et cetera. And this allows them to take the policy that they're not likely to keep through lapse or surrender and invest that policy into an account by rolling the proceeds of their sale tax-free into this senior health planning account. Any of the proceeds and any earnings in that account remain tax-free if the funds are used for qualified medical expenses.
And why is a bill like this needed? Why can't seniors pay for these costs another way?
Well, as you pointed out, there is just a tremendous pressure on seniors and on the healthcare systems and the government systems in order to afford the cost of the rising cost of healthcare in this country. And it's particularly acute for seniors who are living on a retirement income, a fixed income, and oftentimes either haven't achieved their goals or struggle to maintain their standard of living, including those healthcare costs in retirement. So a life insurance policy is just a valuable asset most people don't know about, that they're not likely to keep. Over 90% of life insurance policies terminate without paying a death benefit, which means you're going to outlive your life insurance policy almost more than 9 times out of 10. And rather than just like a home or a car, rather than just walk away from it and get the least amount you can possibly get through the life insurance company, by selling it through a life settlement, they can maximize that value and put a dollar for dollar into this investment account for their health care.
Okay. And you and I have chatted about this before, but there's a lot of money left on the table through life insurance policies, correct? That could be used for these healthcare costs?
Yes, it's tremendous. According to insurance industry research, every year there's about $200 billion of life insurance policy death benefits that are lapsed or surrendered by seniors who could possibly sell those policies. Now, we don't think that market is all available for sale, but it certainly is much larger, and people don't know about it, and that's an opportunity for them to take that policy and make it work for them in retirement.
Mm-hmm. And this new legislation will only help them do that, correct?
Yes. I mean, it does two things. It really creates an awareness for seniors throughout the country that they have a piece of property, that they have an asset in their file drawer that they didn't even know. And that policy could have as much value as sometimes the equity in their own home or other assets that they own. They just didn't know it. So it's creating an awareness, and then also obviously the real dollars that can be rolled into that account on a dollar for dollar tax-free basis.
Okay. Thanks, Michael. Appreciate you explaining that for us today.
Thank you so much.
And if you're interested in learning more about the Senior Health Planning Account Act or how life settlements can be used to pay for healthcare costs, visit lighthouselife.com.